State of the art in surgery for patients with early breast cancer is there are two ways. One is breast-conserving surgery, which still means to remove the cancer with clear margins, followed by breast radiation in most cases, and some sort of axillary staging in patients that have no signs of affected nodes. The sentinel node procedure is still standard care in the vast majority of patients. And when the sentinel node is positive, you can still omit radical surgery in many patients. The big question and controversy is how much cancer can you leave behind in the axilla until you still have to do axillary dissection. And one new area of controversy is what is the standard care in patients with residual nodal disease after neoadjuvant chemotherapy. And this is a topic that was heavily addressed today at the St. Gallen conference, including a debate where the audience was asked, and 60 to 70% of participants of this conference still believe that axillary dissection is standard care for residual nodal disease, and I do fully support this opinion.